back to another episode of the Fill Me In podcast. I'm Injector Jon.
And I'm aesthetic nurse Nicole.
And we're going to dive deep into facial balancing and the art of consultation today.
Yes.
Yeah.
I feel like this is such a big topic, especially for newer injectors, even people that have been doing it for years. I think the full face assessment is very much neglected.
Right.
And it has a lot of potential for not only patient loyalty, but also the growth of your business.
Mm-hmm.
So I feel like it's a good topic to discuss.
What would you say is like the most crucial component to the consultation?
Well, one, I think building a rapport with the client. So I think definitely you have to sit down and you have to make them feel comfortable. I think if you go in there and you just start tearing them apart, that's not a good a look at all. They're going to think that you're just trying to sell to them and they're not going to feel comfortable, or they're not even going to want to listen to what you have to say. I always start it with one, introducing myself, two, handing them the mirror and asking them what brought them in. And then from there, you know, if they say laugh lines, they say, okay, definitely something that we can treat, but let me tell you why this is happening. Go over the aging process and say, you know, I can treat your laugh line, but I'm also going to have to treat your cheek. Or we can treat your laugh line today, but I'm going to have to set up another appointment for you to come back so that we can address the volume loss in your cheek. Because all these things, they aren't just happening in one area. It's happening because we're aging, and this is why, and this is why we need to treat it the way that we need to treat it.
Yeah. I think, like you said, like building that rapport and just connectivity, like connecting to your patients is number one. I like to always find out, obviously, why they're there. But like you said, I think it's great to give them the mirror.
Yes.
And have them explain what brought them there, and then listen for keywords. I think it's really important because a lot of people aren't forthcoming. They don't feel comfortable. They don't want to say it because they don't want to hear it come out of their mouth. Right. So I think if you listen for certain keywords, like feeling tired, feeling droopy, I don't know.
Looking
things like,
sad. Yes.
Right.
Yep.
Right. And find that like emotion that's tied with it, and then go there. And like, if someone's saying, I just look sad, then obviously you're going to be looking at the lower face, right? If they're saying they feel tired, it's usually around their eyes, like maybe hollowness, dark circles, crepiness around the eyes, stuff like that. So I think people also, I think it's, even as a newer injector, I get this all the time. Like, I've just had a Botox patient, like routinely every 3 months. Like, how do you have that conversation about filler? And I think it's really important if first off, if you connect with your patients, they'll end up telling you anything. That's number one. You got to connect with them. You have to be empathetic. You have to be willing to carry a conversation. It's like a barber. Like when you go to your barber, like there's some people, I remember there's certain barbers that I've been to. I literally have been to them twice. They might cut my hair well, but they don't know how to talk. They're just ice cold. I'm not
going back there. Yeah.
They're ice cold and they're talking to their other barber friends. And I'm just sitting there and I feel like chopped liver. Like if you are a patient in the chair and your injector's doing that, they're not going to stay with you. You know what I mean? They want to be the center of attention, and they should, because it's fee for service, number one. And they need to, you need to make them feel good.
Yeah. And a lot of patients actually come in, especially now with social media, they come into your practice, even if maybe you're not on social media as much. There's people like Jon and I that do these videos, and, Injector Bunny that show like full face treatments. Like, they may come in and they're expecting it already, and if they're like, oh, I booked for lips, and then you don't really go past that. They may not feel comfortable bringing it up, and or they might think, oh, well, that's all she does. Maybe all she does is lips, So like, you're missing an opportunity too, because what we just before we hopped on, we were talking about it. Allergan, does all this research, and it's like 92% of people actually want the full face assessment, right?
Even if they come in for Botox, 92% of them want or desire a full facial assessment. But I think 20% or less injectors in the United States actually do it.
Yeah.
Which is low. So that's really a sign for us to incorporate more full facial assessments and get comfortable.
And if you're not doing it, I promise you that patient's going to go somewhere else and find 100%. Someone that's going to do it. Yep.
Definitely.
Yeah. And that's not to say that you should be doing things that your client wants that you don't think they need. I'm just saying, if you don't do that full face consult and educate them on the aging process and what's happening to their anatomy, they'll go somewhere else that will.
Yeah. And I think after having that full facial assessment, studies show that 82% or 83% of patients actually end up booking that appointment for whatever you talked about.
Yep.
So I think too, I mean, anytime you have a cosmetic injectable or a skin consultation, you know, you should be incorporating both injectables and skin.
I love that you brought that up. Yes.
Right.
Yes.
So like just like say, even if they're coming in for just a skin consultation, I all the time end up talking about injectables because they probably have static lines. There's certain things that skin treatments can't do. They can't provide volume.
Right.
They can't do that, right? They can't contour. They can resurface the skin and they can tighten the skin. I think they can lift it, right? By promoting collagen and elastin, but sometimes volume is needed.
Yeah. Yeah. And it's so funny you bring that up because I feel like I do a very thorough consult. And last month, it was probably last month, I had a new patient came in for just Botox. We talked about everything though. I mean, like from skin procedures to Botox to filler, every little thing. And, she was hesitant and rightfully so. It was her first time. So we started with a little bit of Botox and she came back for the follow-ups. I always like to see like new patients that are a little bit skeptical. I always like to see them at that 2-week mark. And she came back in and we got on the topic of skincare and she was like, yeah, I brought a list. I wrote down the skincare that I use because I figured you would ask me and you didn't. Yeah. And I was like, oh, shit, I missed a whole part of my consult,
Oh my God.
And like, you forget, but they actually are coming in thinking like, okay, they're going to bring up skincare and they're going to tell me a regimen that I'm going to want to be on.
Right.
And I didn't. And that was an opportunity for that patient to not only see the other part of my business, which is our skincare and our spa side, but also to keep loyalty with that patient. Because if I didn't do it and if I didn't have her come back for a follow-up and didn't bring it up, she could have gone to the spa down the street to get it,
I know. It's so true.
Like, I almost have to make myself like little check marks, like, okay, brought that up.
Yeah. I think it's just important if they're just in for a regular Botox treatment, right? Like if they're, the first time patient and they book new patient Botox, Dysport, whatever, you should just say like, is there anything else you want to discuss while you're here? Any other concerns? I would say honestly, 65 to 70% of the time they go, actually, yes. Like there's one other thing. And a lot of times it's about their skin or it could be about their under eyes. They're like, oh, I saw you post about under eye filler or PDGF or whatever. Like, can you talk more about that? Like, stuff like that.
And that's a great point too, because, even if they're coming in and I have patients that have been seeing me for almost 8 years.
Oh my God.
And we do almost relatively the same dose every time. And sometimes you just get so in and listen, they're 15-minute appointments. So sometimes you're like running back to back too. But like, sometimes you just get such in that like routine that you forget to ask them. So I before I step out, I always say like, okay, I look at their movement. I'm like, okay, this is what we did last time. It seems to be good, or it seems like you need more. And then I'll say, is there anything else that you wanted to discuss or, talk about today? And just so it opens that door and we're not just leaving on, okay, you've been coming to me for 8 years and all we're doing is Botox every time. Like, did you want to talk about skincare? Did you want to talk about fillers? Did you want to bring anything else up? It opens that door. Uh-oh.
Oh my God.
What happened?
Can the viewers, the listeners hear my dogs barking in the background? Because the UPS man is here. I'm really sorry.
Oh, their favorite.
Joey will have to get this cut out. Oh my God.
No, I think we should leave it in.
I have 3 golden doodles and I can't control them.
They are like little humans.
I know. Oh
my little dog is out there somewhere. She was sitting at the glass door before trying to get in here.
Oh, really? I know. I let the door open. I was like, oh, I'll just let them.
Yeah.
Hey,
let
girls.
Hang.
Come here, girls. It's okay. Oh my God.
They're just being good watchdogs.
Oh my God. It's okay. Here you go. I know. It's okay. Hey guys, just popping in to remind you to like, subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector Jon and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
There's a lot of resources from Allergan, actually, if your office that you're working for, or if it's your own business, if you have an Allergan rep, they have a lot of resources when it comes to like those rip pads. So like it's one that you can hand the patient when they come in, that basically shows all different skincare concerns, filler concerns and Botox concerns, and it asks them to check off anything that relates to them.
Mm-hmm.
And there's actually pictures. So like, it's like kind of foolproof. So like, if you feel like you're a newer injector and you're like, oh, I just really like don't feel comfortable bringing up the topic,
I know,
or like it's awkward, or I'm in a rush and I don't, sometimes giving that to them as they walk in can, one, help you prepare to walk in the room with these thoughts already ready to go.
Yeah.
Or two, you don't have to bring up the conversation. It's already done for you.
100%. They also give like really good tools. I love the where you can touch and feel the filler. Like
Oh
this little
yes,
thing
I have
opens
those
up.
in all the rooms. Yeah,
It's great. And then there's like that little, like it almost looks like a what is it that like?
Oh, like the paint.
Yeah, it's like a
like
board, and it has like the different.
yeah.
Like this is what one syringe looks like, 2, 3, 4, 5, which is nice because a lot of patients are. I mean,
so terrified.
So terrified, and I would say the majority of patients coming in, like, if we recommend hyaluronic acid filler, right, for volume deficit and restoring structure in the face, like it's all about your vocabulary. I feel like you use too. I think that's really important. I genuinely don't really like to say filler. I try to say like hyaluronic acid, like structure. We need to kind of tack this back, lift this, disguise the jowls. Like, trying to like break it down like that will make them less like, oh, like for lip filler, hydration. We need to do a little bit of hydration to the lip to smooth those fine lines.
And like not calling it a syringe. It's just a treatment.
It's a treatment. Yeah. Right. And it's restoring volume that's been lost over time, blah, blah, blah. But I think if by showing that little like one syringe, it's like, oh, it's the size of a blueberry. It's really not that much. And telling them that, we lose about 5 syringes of filler a decade from the time we're 30 years old onward. So if you're in your 50s, 60s, that's 5, 10, 15 syringes of filler you've like lost, sometimes almost 20 syringes, right?
Yep.
So just educating on that, I think, is super important. And we deal with all the time, Nicole, right? People coming in and they're just like, I'm so scared of looking fake. I want to look natural. And like before you start, like you think you gained the trust, right?
Yeah.
And then you go to start and you're like, really quick, sorry to be annoying, but I just want to make sure that I really just look like myself. And like when I go home, my husband's not going to look at me and go, oh my God, what'd you do? And, you have to say, nope, don't worry. I got you,
Yep. And I like to tell people too, like, listen, you're going to feel puffy when you're swollen. Like
don't
the
judge
first
yourself
couple,
the first few days.
Exactly. Like, but I don't want you to panic because that is not something that's going to linger. It's just that you have to kind of trust the process. And I also need to feel comfortable that the patient's going to trust the process.
Right.
And that's the thing as a new injector, that's a little difficult to figure out too, because you really have to kind of weed out these more like red flag patients that are going to end up just being unhappy or an issue. And you can usually tell that in the consultation if they're, giving a lot of pushback or, if you don't feel comfortable, just say, listen, I think you should really think this over. If you decide that it's for you, I'm here, but for now, I think we should hold off. And it's okay to say.
Yeah, and give them a little consultation card. Like write down like what your treatment plan is, write the cost, send it home with them. Because honestly, a lot of times they just have to discuss it over with their husband or loved one, or they have to budget it, or
talk to their friends that have done it and been like, did you do 6 syringes? And their friends like, I did 8. Like
right.
So is that something that you give them to go home with? Is like a
yes, a little breakdown.
I think it's so important.
Cost. Yeah, because honestly, I would say like 85% to 90% of them. There's like just a small percentage that they don't do it, or they do it maybe a year later, just because they really. But
it's funny how long they'll hold on to that sheet, right?
Yeah,
they'll come in. It's like crumpled up, and it's like
100%.
I take pictures of all of them and I put them in their chart because sometimes I know people will forget it. Like on Aesthetic Record, they have the gallery where you can like upload anything. So I like to take pictures of it, but I made my own on Canva, and it's just what works with my brain.
Yeah.
And I think it's so important for patients to leave with something tangible. Yeah. Like if you just spell it out for them and say, okay, listen, this is what it'll cost you. See you if you want to do it.
Right.
And they leave, like, they're not leaving with any thought in their mind. They're just kind of like confused and they have nothing to refer back to.
And honestly, they're going to find someone else that might make it easier for them.
Yep.
Yeah. Because we put the idea in, but then they're going to go somewhere and be like, yeah, I got a consult. And then, but they want a little bit more hand holding.
Yeah. Yep.
Yep.
Yep. And I like putting the aftercare on those too, because it kind of, even if they don't decide to do it that day, like they go home and then they can kind of also read what to expect.
Yeah.
How am I going to heal? What can I expect aftercare wise? Which I think is huge as well.
Yeah. I think definitely, like, it's important, like you said, I think you picked up on like red flags and stuff, like picking up on certain things. It's always a concern of mine, like when I have like patients that want perfection.
Yeah.
They want things to be perfect. They want one side of their face to look exactly like the other side. It raises my flag if I hear a patient say they've been to like multiple injectors and they just haven't been
Never
happy.
happy. Yes. Yep.
So I find out, well, what are you looking for? And get down to it. Like, what is it? And usually if you like you're able to find it out.
It's that education again, because I feel like a lot of the time, especially as a newer injector, I was kind of like more apt to say like, oh, well, okay, it was probably their technique. Like I can do that for you, but like, maybe I can't, now I say, listen, it may be your anatomy. It may be possible that you walk out of here with the same exact result you got from that other injector from me. And I just want you to have those expectations. Like you might just not like the procedure itself, or like sometimes people just don't understand lip filler is always going to have a little bit of like puffiness and there's not going to be, some people think they're going to get that real, like, these photoshopped Russian lip pictures. When someone shows you that, you just want to like run out of the treatment room. But like, that's immediately after injection. Like, of course it's going to come down. Of course they're not going to stay lifted and sharp like that. Like it's not going to happen. And some people don't want to hear that, but there's a potential that your result is still not going to be the expectation that's in your head because I can't be in your brain. And I think it's so important to feel comfortable explaining that to them, because if you don't, and you heard all that beforehand, it's a possibility after the fact. It's just better to get it out beforehand than deal with it after.
Set the realistic expectations. And if you genuinely feel like you can't make them happy, you just say like, my worry is that anything that I do isn't going to make you happy.
Right.
And if you get that out, it might honestly break that barrier.
Right.
And they might be like, okay, like, no, like it's totally fine. And be like, okay, I just want to make sure, like, if you pay for this, it might be 60% better or 40% better. Are you okay with that? Like,
it's so much better to what do they say? Undersell and over provide. Like you never want to be overselling and then have them be like, oh, well, it doesn't look that, like it's not that different. Yeah. You never want to overpromise. Yeah. Yep. And I just find like, there's no point in injector bashing. Like when someone comes to me and shows me something or like they're migrated, I'm like, listen, this could happen to me too. Like these are things that unfortunately, sometimes it's just your body. Listen, it definitely could have been the technique, but sometimes it's just the way you heal. It could be anything, I don't like to put blame on anyone because again, at the end of the day, it could be you too. That could happen to you in the future. And you don't want someone saying like, oh yeah, it's because they're terrible, because they're not.
Yeah. 100%. Yeah. I also think it's important to get pictures before. Yes. I think anytime like I used to hear this, I'd be like, I'm like, this is a boring conversation. But now it really does make sense.
Understand the importance.
During my consultations, my medical assistant will get the pictures before I even go in the room. And then I actually get them up and I show them their picture. So when you look at yourself in the mirror, you see someone completely different than you in a picture. You in a picture and you in a mirror, completely different people. So if and once I do that and show the patient like this is them, they're like, oh, I didn't see myself like that. And it's really good because then you can kind of walk through what that picture is showing and talk about the science behind what's going on, the anatomical changes of aging, the bone loss, the muscle relaxation, the fat pad loss, or the fat pad redistribution as we get older, and the collagen loss and last in the skin. It's just really nice to like go through all of that and working literally from top head all the way to the clavicle. So now that we have the FDA indication for neck, obviously we're now going into the neck, which is great. And all of any pictures now, if you're just doing viscia of the face, I encourage you to keep doing the viscia, but have them also do like, pictures on your iPhone
from the collarbone up.
From the collarbone up. So that way you can address the neck, because we all know like celebrities, like their faces sometimes look great, but sometimes we look at their neck and we're like, oh,
it gives it away.
It gives it away. And me now, like as an injector, your provider, I want all of you to look great.
Yes.
You know what I mean? Because I want them to go be like, you look great. Like, from here to here, like, where do you go? Right.
Yep. Oh, I love that you touched on like going through during the consultation, the anatomy too, because it's like, I feel like one that'll stand you apart from a lot of other places. If you take the time because to a patient, they're like, I have a divot in my cheek, but to you, you're like, okay, that divot's happening because your fat pads are separating, you have ligaments there, but like they don't know that. And if you take the time to explain to them, this is why it's happening, and this is also why I can't fully correct it, because you're going
Yeah.
to look like Catwoman, or like if you take the time to explain what's happening underneath the skin, they're like, oh, it just says like a moment of realization.
Yeah.
But a lot of people won't take that time. And that's why a lot of patients expect to look like they've been face tuned or filtered,
Yeah.
because they think that it can be erased 100%.
Yeah, definitely. And our ligaments, just like our muscle, they relax as well. And lights and shadows are really important. Like taking a picture and seeing, like, if you look at that, I love the whole like mother daughter like
Yes.
comparison.
Yep.
And the daughter looks it's like the triangle of youth, right? And
Mm-hmm.
then when you get older, it's the reverse triangle, and your light reflections, you might have more light showing like on your jowls, more lower in that lid cheek junction, right? In
Mm-hmm.
this area, you're going to have areas on your face that are accentuated, that are showing more light that you don't like.
Yeah.
So it's all about finding the lights and the shadows, explaining why certain areas are more lit up as we get older.
Mm-hmm.
And that also helps to determine proper placement of the hyaluronic acid fillers like Juvederm, Restylane, whatever you use.
I actually use that triangle often to
Love it.
explain to my probably 50 and 60-year-old women, because they're like, it's just not fair. Like my husband gets more attractive with age. And I'm like, actually, that's so funny you say that, because we all widen in the lower face with age, and on men, that's attractive.
Yeah.
On females, that's what ages us. And they're like, oh my God, like I've never thought of it that way. Like a guy is supposed to have a nice wide jawline that looks masculine. So as they age, it's okay for them to widen out here. But for us, it gives us that jowly look. We look sad. So it's funny when I explain it to them that way. They're like, oh my God, that's why guys age so well, because they're allowed to have a wider lower face. And two, like you touched on the lights and shadows, I like to discuss lights and shadows with every patient, because like I do a lot of full face like you do too. And I think sometimes patients, what does Jubilee and Julie call it? The two finger lift. Like they come in doing the, and it's just so important to explain to them that filler is not, yes, it will lift a millimeter or two to the naked eye. That is like not visible, honestly.
Right.
It's more about hiding specific lights and shadows, and it's giving the illusion that everything is more lifted. And that's how I explain it to them. So like if you have a divot here in front of your jowl, I'm going to fill that divot, and it's going to give the illusion that your jawline is tighter. But I never like to sell like, oh yeah, I'm going to place it back here and it's going to pull everything back. Like obviously I'm going to place some back there to tack back, but it's not going to be a facelift,
Yeah. No, it's so
it's
true.
all about the way you explain it. And I think using specific like layman's terms for patients is huge, and not going too scientific on them, but also still educating them.
Yeah. I like to say, when I'm going through the process of aging and I'm doing a full facial assessment, especially like someone in their 50s or 60s, even 40s, but I would say more 50s, 60s, is we lose the fat pads in our forehead. So as we age, we actually get a little bit of a divot or curvature in our forehead.
Yep.
In Asian culture, I think they actually really, and I know Vanessa Lee, she talks about this. She's also an injector out in California. She owns the Things We Do. She is like a certified reader of something. I forget what it's called, but it's really, really interesting. But basically, a telltale sign of aging for their culture is
the forehead.
It's the forehead and fat loss in the forehead. But as we get older, we lose that fat there. And then we might wonder why our Botox isn't lasting as long. It's not that it's not lasting long. You can't blame the neurotoxin. It's because you're losing that support, those fat pads underneath the skin here.
That used to plump it.
And now any movement will cause a little bit more rippling than normal, right? And then we go into, so sometimes as we get older, we get the shadows here in the forehead, we get shadows in the temples, right? We get hollowing in the temples. Our under eyes are more shadowy because everything's, that lid cheek junction is becoming more elongated. And then also our submalar area, this area starts to get more shadowy, right? And then the light reflection is more in the jowls and the darkness is more in the posterior mandible. And that's where we need to treat is honestly the temple, the cheek, the posterior mandible, preauricular, and then move forward. And if there's anything up here, I always, and you're the same way, I always try to treat superior, posterior, laterally first, right? And then assess this area.
Yeah. And you explained it perfectly. It's because we lose the fat. So we need to go back and relay that base layer that you once had, and then do those little intricate spots.
Yeah.
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 A great tool for that is, if you are an Allergan account, is the MD codes.
Oh yeah.
You can find, I'm pretty sure you can find that on the Allergan educational website. You can watch videos on it, but he explains it so well. And it's a way of injecting the face where you're not chasing volume here. You're replacing it where it needs to be to give that illusion of the lift and all that.
Yeah. It's amazing. And you do get some neocollagenesis from injectables. So like, that's why too, if you notice effort to getting facial balancing, you're using maybe a combination needle cannula, all of a sudden 2 or 3 weeks later, your skin's glowing, you know, and it is because you get a little bit of collagen production from that controlled trauma, right?
Yep.
Yeah. Especially if you're doing cannula and you're doing some
like subcision
removal, some adhesions under the skin, you're going to get a nice glow about the skin.
Yeah.
Yeah, I love it. I think too, it's really important. Anybody getting any injectors that are listening in to consider adding on like a discounted price for skincare after you are providing facial balancing for them. So if they're investing in like 5 syringes plus a filler, talk to them about TNS, talk to them about if you have plated, some growth factor serum, right? Anybody in their 40s, 50s, 60s needs to be on like some type of growth factor collagen peptide serum. So start them on that, because that'll be their homework at home and optimize their results at home.
And an HA too, like
hyaluronic acid.
Topical HA with the internal HA, like they all play together.
They do.
Yeah. So no, that is huge. Doing like a package kind of, if you do a full face, you get a certain amount off for the skincare. Cause you're right. Home care is huge. If they're not doing anything at home.
Yeah. And
the
sometimes
results are just not going to last.
Even sometimes I'll include in my treatment plan for patients Skin Vive if they can do it, just to do that after their treatment, just because that glow
and it's
in
like
the skin,
such the icing on the cake. Like
such a nice glaze.
If you have like a little line or like a little acne pockmark or like just a little something that you can't get with that deeper filler that you did, you get in there with that Skin Vive and it really does give that luminosity and that more soft appearance. I never like to use filtered, but it kind of gives a filtered appearance.
It does. It gives that like glazed, that just nice glow, youthful glow to your skin.
Yeah.
Oh, it's beautiful.
Yeah. But I really do think this is such an important topic, because especially for newer injectors, it can be like weird to have to bring up the full face, but it really relays back to your patient retention. And like your patients are really going to feel seen and heard if you're taking the time to go through and tell them, listen, this is what I'm seeing on you. And this is the aging process. And it's not something, a lot of the time I like to say, like, this is not crucial. This is not something you have to do, but I'm just letting you know, if you're looking to balance and you're looking to harmonize and you're looking to, make yourself look a little bit more youthful, these are the things that I would suggest. But it's 100%. Not something that someone on the street really going to pick up on, this little line that you have, this divot. Like, no, it's not. No. These things aren't do or die, but they're things that you can definitely do and help yourself in the long run. Catch them while they're not. That's the other thing, is people wait too long, and then it is unfortunately just a facelift.
Sometimes the people that wait too long that come in and they really don't want surgery, they just have a lot of skin laxity. And for those people, it's like, well, we really have to work on tightening your skin, because if we just shove filler under your skin that's very lax and there's no support, your skin's not going to support the filler well. It's not going to integrate well. So sometimes I'll have them do RF microneedling. I'll have them do soft wave, or for you, it would be the face tight. Right, or something, right, that you could do.
Skin tight,
pen. Skin pen can help with texture. But,
Moxie,
Oh, yeah. So you're just really going to work on that skin integrity first before you incorporate that filler.
Sometimes I think, too, as a newer injector or just a newer practitioner in general, like you almost feel like these people aren't going to want to spend the money, or they're not going to want to travel here. Like I just had someone the other day who not open to surgery. We did discuss the need. Like I do think she would really benefit from a CO2, which obviously I'm not able to do for her. And that's, again, being an honest provider, I think is huge too. If you really think they can benefit from something, even if you don't offer it, I think it's worth sharing with them. Like surgical lip lifts, I tell people a lot about too. But I wasn't able to do the CO2 for her. And I was like, let me just send Britt in there to chat with her about skincare and like microneedling, things that can make a difference, but they're not going to be surgically drastic. And she ended up doing the skincare. She ended up booking the microneedling. So like people really do, they want it. They want to hear it. They want to know what's available. So don't not say it just because you think someone's not going to do it, because like we said before, 92% of those people want to know.
They do.
Yep.
Yep. Just in conclusion too, just to say that, so with a consultation, connectivity is so important.
Yes.
Sit down, sit at eye level with your patient. Don't stand. Your nonverbals are so important. So if your hands are, if you're stressed and you're anxious and you have an off day and you're standing like this and your hands are like this and staring at them, listening, and your head's tilted, you might come off the wrong way.
Yeah.
So just make sure that you're relaxed. You try to relax, you take a deep breath before you go in and just make them feel comfortable.
Right.
Patient connectivity is like the number one thing I could say, that you're not going to sound salesy. And what else?
I think too, when you really put the science behind it and you fully understand what you're doing, you'll never sound salesy because you're not selling.
100%.
You're treating, and it's a medical procedure. Yeah. So I feel like that's where educating ourselves comes in so much handy, because if you're seeing our profession from the outside, I can see how a lot of the time it can look like it's a salesy thing. Like, we're not selling. It is a medical procedure, and it is a medical treatment.
We just sell the outcome. Right. I want to sell the outcome because we know what works. And of course, at the end of the day, it does come down to budget sometimes, but I don't plan it around budget. I give them an honest answer of like what I would love to do. Yep. And then here's the budget. And then we go from that.
I'm actually really glad you brought up budget, because there are so many options for patients now. Like Alipay. Alipay is like a version of Cherry.
Ally payments powered by Cherry.
Yes. Incredible. Cherry, Care Credit. Like, there's so many options. Affirm. Like, so I have an app for ours. It's from Repeat MD, but on the app you can purchase on the app and use Affirm. So it's like, there's so many options now. Great. And again, that's another thing, that if you don't bring those options up to your patient, you might be losing a patient as well, because they may not know that's an option. They Google it, they find it at the spa down the street, so it's like, you have to be bringing all those things up to them.
It's really Alipay, which is Cherry. So it's Ally payments powered by Cherry, has really been a game changer for patient financing in my practice. Like, they really they'll get pre-approved from home, right? Yep. They'll go on their app, they'll, apply for it. There's also a payment estimator on the Ally app too, which you can actually estimate what your monthly payments would be, and also look at your APR, which is really cool. So that way they can budget and plan for what they're going to do. Also, there's so many people that they get pre-approved and all of a sudden they're in for Botox and they're like, well, I'm here. Can I do my cheeks too?
Yeah,
or do my chin?
Yeah, exactly.
I got pre-approved for this. This is amazing. I don't have to owe this all at once. I can pay a little bit over time.
And it's not a hard credit check, so there's no harm to your credit. And as a business owner, the Cherry, the Apple.
Yeah.
The Alipay really makes the most sense for us, because Ally takes on a lot of the percentages too, which is,
now I know, want an Apple.
I know. Sorry. I was thinking Apple Pay, like when you scan your card, your phone. Sorry guys, pregnancy brain.
Oh my God. It's real. It's real.
But as anyone listening that's a business owner, the Alipay actually, they take on a lot of those charges that we typically get from Care Credit. Like, Care Credit could be 10% sometimes, and it's insane.
I know. Sorry. You're really making me laugh right now. I can't.
John's been listening to my word searching for the past 3 hours now.
Oh God, no!
I swear,
you're doing great.
All the words are up here. They're just scrambled.
By looking at you, I can't even tell you're pregnant.
Oh yeah.
I'm sorry.
And he's like fully dropped.
Which is insane. Ugh. Insane.
Look at that. He's so low.
I know, but I still can't get over 2.5, 3 weeks ago, I was at your place and from the front, if she was wearing all black, you could not tell she was pregnant. There's literally a picture on Instagram, and did someone not say
yeah, they were like, where's your bump?
Where's your bump?
Did you give birth?
Oh my God.
We're getting down to the wire, you guys. Any day now.
Any day. May 31st is your due date, right?
Yeah.
Crazy.
Yeah.
You can't tell us. You can't tell us yet what the name of the baby is yet, right?
Oh, when will this come out? I probably can say it.
But what if you go late?
Well, Joey will just cut it out otherwise.
Oh, okay.
It's Avery Fox Andriano.
Wow.
Yes.
Love.
Yeah. And for those that get confused, I never changed my last name. So that's why I'm Bauer, but my husband's last name is Andriano.
Avery Fox. I love that.
Yes.
All right, guys. Well, this was a great and fun episode. I hope you guys learned a lot, took a lot from it. And also, if you guys have any like tips and tricks too, like what you guys use for consultation, please let us know. Shoot us a DM or also comment on our posts. We love you guys, and thanks for tuning in to another episode of the Filmian Podcast.
Bye.
Bye, guys.